Hello everyone, welcome to another video on refractive eye surgeries. Today we're going to be covering LASIK. Before we begin, I just want to go over a quick review of the cornea. So here's an eye I drew like this and the cornea bulging out over here. If you zoom into it, you can kind of see the 5 layers of the cornea that I've drawn out over here. They're the epithelium, most anterior to posterior. Epithelium is most anterior, followed by Bowman's layer, and then the stroma, Descemet's membrane, and the endothelium. The two most important ones to remember for LASIK is going to be the epithelium and the stroma. For refractive eye surgeries, there's actually 3 main techniques you can use. The first one I went over already in a different video you can check out on this channel. It's PRK. The second one is the one we're covering today, which is LASIK, and the third one is SMILE. So now let's actually talk about what LASIK is. And the way I'll structure this is I'll kind of write out all the steps of LASIK surgery first, and then after I do that, I'll illustrate all the steps in picture format so that it all kind of makes sense at the end. So step 1 is that the surgeon will create a flap in the corneal epithelium. And after that flap is created, the flap is peeled back, thus exposing the stroma. The next step is a laser is used to correct the refractive error. And finally, the 4th step, the flap is replaced and the epithelium comes back together. So that's a lot of words right now, but as I illustrate this, hopefully it'll make a little bit more sense. So let's illustrate the first step first. I'll draw an eye out over here as if we're looking with the bird's eye view. So this is kind of the sclera over here, and then this is the limbus, and then I'll draw a pupil here too. So step 1 is the surgeon creates a flap in the corneal epithelium. What that looks like in real life is the surgeon will go around the epithelium and cut a flap just like this. But notice how there's a little edge. I'll draw it in green here. There's a little edge that the surgeon doesn't cut. So that stays intact, but the rest of it is cut. And then we move on to step 2. So I'll draw an eye once again, our same eye as before. And I'll draw that little intact piece of the epithelium that the surgeon left from the previous step in green once again, right there. The flap, though, I have to draw up kind of like this. And that's supposed to represent the flap being peeled back. And with the epithelium peeled back like that, you can see in blue some stroma, and that's important for the next step. So step 3, a laser, which I'll draw in red here, is shot at the eye after calculating how much it needs to correct, and it reshapes the stroma to hopefully eliminate the patient's refractive error. And after all that is done, we come to step 4, which is simply that the surgeon replaces the flap back to its original position, just like that. And over time, the epithelium will come back together, and hopefully the patient's refractive error will be corrected. And that's it for LASIK. Thank you so much for watching. I hope this was helpful.